Ask any question. What's going on? We are live right now. TikTok number 26. It's been a while. It's been a while, guys. It's been a while since I've been on. We're on today, though. Here we go. Let's see. Terrell, Nikki, Soraya, Edwards, Carla joined. William Garcia joined. Lowe joined. Keeks joined. Evangelical Daddy joined. I don't know. Wow. It's a long one. Marilyn joined. What's up, Marilyn? Been a little while, guys. Been a little bit before I was able to get back on to the TikTok lives. Thanks for tuning in. It was a busy couple of months. I was at the public hospital for the rotation there, 3-4 months. And actually tomorrow, on the record, tomorrow I start like what's considered chief year, the last year. It'll be the last year of my residency. So tomorrow starts the first day of it. So technically less than 352 days left. Wow. Kat Seneco joined, Jamie Brenner joined, Octavius joins, Liz Woods, Arelli, KC 1942, Casey, JW, Jenny Buchanan, Amaranta, Patches, A joined. What's up, A? Hey, how we doing? It's been a while. Been a little while. Thanks for coming on. What else? Tomorrow I'll be at the dental school. I do the dental school for 3 months, so that'll be the beginning of this year. Dental school rotation for mostly sedations, wisdom teeth, exposing bonds. Those are going to be the procedures that I do at the dental school, so I'm pretty excited for that. It's the closest thing, except for Mondays. The rest of the week, relatively, it's the closest thing to like a 9 to 5. So I'm pretty excited to really get some time outside of residency, to be studying, to be learning on my own, to really get in touch with, get back on podcasting. Right now we're doing the TikTok live, number 26. 26 lives. Guys, we already completed a quarter of the way to 100. Good stuff, guys. And thanks for coming on. What questions you got, guys? Let's go. What are we starting at? You got so many people joined. That's a lot. And no one asked a question, guys. Come on. What's going on? What questions we got tonight? There we go. Leah Cannell, what's up? Wish me luck taking organic chem right now at Stony Brook. Oh man, Leah, good luck. Organic chem, that was good. That was a great one. You got to practice those reactions. It really depends on your professor, right? Like my professor was all about reaction and equations and such. So that was big for us. I just made index cards. I would recommend Quizlet, honestly, now. Wish I knew about that when I was in college. KC 1942. Appreciate your content, man. Love that you educate us. Just talking about the day in the life, you know. I've found that it's relatively unknown what is actually spoken about in residency. Like, say you're an undergrad, you're in high school, you're in dental school, you don't actually know what goes on a daily basis. And over the next few years, because I can only get so far in depth into it right now during residency, over the next few years, I want to try and give some more light, shed some more light onto what that experience is. And, you know, as I do those daily. I got to apologize, though. It's been a few weeks before I've been able to get into the comments and respond to comments on the TikTok videos. So that's on me. That's something I got to get. I have to catch up with. So that's definitely me, but I have it in mind. LinkedIn as well. I've been behind on LinkedIn. More so on TikTok. Second place is LinkedIn. So I gotta catch up there. Anna asks, what are some procedures you've done this week? So last week, we had an orthognathic surgery last week. Orthognathic surgery is the big surgery where we cut the top jaw, cut the bottom jaw, the mandible in the back. This was what we call a triple jaw. So one jaw, two jaw, and the genioplasty too. Obviously, there's only two jaws, but we call it triple jaw surgery when we add on that genioplasty in the front. You can move it up, you can rotate it, you could tilt it forward, backwards, etc., and so on. That was one last week. The week before that, 7 plates were put on. Almost panfacial trauma. Panfacial trauma is when all 3 parts of your facial region have, you know, a traumatic event where, like, imagine this, and this is scary, but I've seen this. Imagine you take a pizza box, right? And you just like mix up the pizza inside and you open it up. Well, it's going to look like mush, right? We've seen multiple times over my residency so far, the last 3 years, so many patients, like their facial bones, that's what it looks like underneath the soft tissue. Just unbelievable. And, you know, really sad that patients have to go through this. And then when we get them, we got to put those facial structures back together. So a week and a half ago, it took 7 plates. It was like the lateral orbit, the orbital floor, the medial orbital rim into the nasal bones, connect the zygomatic bones back to the maxilla. It's a ZM suture, Z for zygomatic, and M for the maxillary, so zygomaticomaxillary suture, as well as the piriform rim. Piriform rim is the edge of the nose to the end to the maxilla, so 2 plates along there. That's about 7 plates, yeah. So there you go, 7 plates, just unbelievable. Great experience, a lot of fun to put it back together. Just sad to see people go through this, Apple user 8393 got a full gold crown, PFM crown practical tomorrow. Please pray. I got you, Apple user 8393. Good luck on your gold crown PFM preps tomorrow. That's a big Simline one. Gabrielle Mamagonian. Thoughts on med school versus dental school? Well, med school, you're going to have a lot more free time than you will in dental school. Dental school is a lot more hands-on. You have to handle all courses, but all 4 years, you're also honing in on your hand skills, right? You're doing crown preps. You're learning about tooth anatomy. Dental morphology is the first dental school course you'll take, or at least at Stony Brook. That's what we did. Med school is a lot bigger subjects, a lot broader subjects of the systems. And remember, in dental school, your first year or so is in medical school. Right? That's the first year, or give or take, depending on what dental school you go to, you're going to be in medical school. So that's something to consider. You're still doing a portion of that. Medical school, there's a lot more going on. And I didn't go to the full medical school, right? So I can't tell you 100% from my experiences because I don't have it. I only did 9 months or so, a little more than 9 months of medical school then. And then I see on rotations clerkships, you meet medical students when you're in the hospital on your rotations on trauma surgery, general surgery, bariatric surgery, so on and so forth, hand and plastics, and that's towards the end of medical school, the medical school experience and curriculum. So lots of stuff there. But one versus the other, I don't know. I did dental school. It was a lot. Wasn't that great. You meet some great friends, meet some not so great friends. That's just any dental school or medical school, right? Abdo followed the life creator. Thanks, Abdo. Hayden Harrison, tips for intern year. Yeah, it's really just going to be, come early, stay till the end. You're going to have to stay till the end, do your tasks. I wouldn't let the tasks you can do now or today, right? Don't let them roll over. That's like a general concept for anything. If you could do it now, get it done. In intern year, I would highly recommend doing that. The reason being is that you don't know what's going to hit tomorrow, how many more tasks you're going to have. If you can get it done today, get it done today, because things are just going to pile up tomorrow, the next day. Another thing is in the morning, I would get up, try and get to bed earlier, because in intern year especially, you're handling a lot of like the task work. And so when that emergency comes in and you got to call the CT because the attending wants a 3D recon, you're calling to book the OR case. You're calling your OR coordinator. Can we get on the schedule for today to repair that massive laceration in the OR? The chief or senior level residents are going to be coordinating that, but you're going to have to do all those tasks. You see what I'm saying? So getting in a little bit earlier every day is good. As an intern, it shows a lot for you if you come in earlier. I wish I did that. I was exhausted. I don't know. Intern year, we didn't have a PA at that time. We didn't have an OR coordinator at that time. It was still during COVID time, so we had to get a COVID test in from patients within 3 to 5 days before those surgeries. So I'm calling out people on Monday to get their COVID test for their surgeries on Wednesdays and Fridays. And then later in the week for Mondays and Wednesdays. Now we have a PA who can handle that. We don't have to do COVID testing anymore. We have an OR coordinator now, so she's helping us get OR cases up. That was all on top of the general intern work. We don't have a non-categorical resident in our residency here, so there was just one intern. That was me. I had to do all that stuff. And it took away a lot from bigger surgeries, and it conflicted with getting stuff done in clinic, so intern year sucks. Anyway, and you know what? Intern year sucks. It sucks for everyone, but not similarly. Depending on how that intern is treated by their upper level residents, how much they feel like it's a team. It's like how much teamwork is utilized, or like the work is spread out. Like there's how an intern is treated by their upper level residents really greatly affects their motivation, how well they get tasks done, how much they're happy day to day. Are they going to drop out? And I've seen that too, but I don't know. That's residency culture is something that I will continue to talk about over time because it's so important for the motivation and enthusiasm and overall attitude. The vibes. Vibes are so important. It's literally the difference between when you're going to choose this bar or that bar, right? And I would really think, I know that it really affects on the day-to-day overall morale of a residency program. So anyway, PT Buzz. Wait, I'm skipping people. I'm sorry. Missy Rashid. I'm obsessed with chewing ice. Please help. Chewing ice. No bueno. Good for extra teeth and so on and so forth. PT Buzz. What do you think about those home dental picks that you can buy to remove your own tartar? Probably not a good idea. Let hygienists and general dentists. When you go to every 6 months, you get your teeth cleaned. Sometimes up to 3 months if you have certain periodontal issues. Let them do it. Toothpicks. What if you cause gingival recession? Now what? It can do that. Isaac said, getting ready to start dental school in August. What do you recommend doing to boost residency application? Your residency application. Well, GPA, your ranking through the years, I would say, obviously, letters of recommendation. Letters of recommendation are going to be dependent on how well you connect and interact and develop a relationship with your attendings, your professors, your teachers throughout dental school. That's a big one. For oral surgery specifically, your CBSE score is going to be within the top 3 things. That's definitely something. And then towards the bottom, externships. That's huge for oral surgery, not necessarily for other residencies or specialties. And then what else? Research. Research is a good way to get involved with attendings that maybe will write your letter of recommendation. Be a great way to get involved in the dental school. Maybe work on a team for that research project potentially. Stuff like that. Not necessary for so. Ortho loves to see research on your application. Perio likes to see it. Ortho loves to see it. OMFS, depending on the program. Some love to see it. Some, they don't care that much. Okay. That's just some stuff. Official Sports Talk TV. What's up, man? What's up, friend? Brendan, my guy, nice to see you back. Build me a starting 5 of your favorite NBA players. You're awesome, man. Let's see. Larry Bird, Pistol Pete Maravich, Magic Johnson, Michael Jordan. Ooh, we need a little more height. Was Bernard King? No, Bernard King was a small forward. No, I wouldn't put him in there. Let's see. So Pistol Pete, point guard. Michael Jordan, shooting guard. Small forward, I would. Oh shoot, we have Magic Johnson. Okay, let's put Magic Johnson at point. I'm sorry to get Pistol Pete out of there, but gonna go with Larry Bird, Magic Johnson. Let's put Michael let's put Michael as shooting guard. Larry Bird as small forward. Now we need to get some size in there. Who are we going with? Ooh, Kareem Abdul-Jabbar. Oh, and Shaq. Imagine Shaq as power forward and Kareem Abdul-Jabbar for center. That's going to be my starting 5 of all time. And no, absolutely not LeBron. LeBron could go sit on the bench and whine over there, right? He's not going to whine on my court. If I'm the coach of this team, he's not whining on my court. Oh my God, have you seen some of the fights? Kareem Abdul-Jabbar, Magic Johnson, Larry Bird. Let's get some tough guys on the court. Okay, that's who I want to see on the basketball court. Not any of this whining stuff. All these complaining, going around like this with your hands up. Grow up. Okay, so that's my little rant. NBA sports. All right, Soraya _day. Medical residency versus dental residency. Well, you said, I know some people say dental is easier, but can you really compare? Yes, I can compare. Now, oral surgery residency, remember, we are the bridge between medical and dental, right? We see a lot of medical, not all. We see all of the dental side, and we see a lot of the medical side. Everyone else on the medical side doesn't know what's going on the dental side, and everyone else on the dental side does not know what's going on the medical side. The dental residency is very separate from everything, for the most part, in the hospital. Now, many times, dental residencies take call, but that's just GPR, peds, not here, by the way. GPR does, peds doesn't, and it's oral surgery. Most pediatric programs and GPR programs, they do take call, right? And GPR takes a bit of call, but they're not on every day, so I can't say that they take a lot of call. And oral surgery residency, we take call every day. Some oral surgery residencies are tough, are soft. I'm hearing about GPR residencies telling me that they can't get an oral surgery resident to come in before like 7 a.m. That's kind of soft. I haven't heard of that. That does not happen in our program. We get in massive trouble if that happens here. So, but dental residencies in general, you're telling me like GPR residencies, you're telling me about perio, endo, pros residencies. Sure, maybe they're 3 years. That's a long time. But they're not taking call over there as an endodontist or a periodontist or a prosthodontist. Some prosthodontist programs, they kind of add on call mixed in, intermingling with the GPR. But if you're not taking call, you're having an easy residency. You're coming in, maybe it's 8 to 6, okay, but you're not taking call. You're not managing emergencies in the ED. You're not getting called up at 2:30 in the morning in an endodontics residency. And so that's easier. And in a medical residency, at some point you're taking call, and call sucks. Some residencies, my God, ortho, plastic surgery residencies, they have the hardest lifestyle I've seen. No, I'm sorry, neurosurgery is by far and away number one hardest lifestyle I've seen. And we interact with them every day, sometimes some weeks every day in the hospital. So I'm telling you right now, neurosurgery, at least here, is the hardest residency I've seen, with ortho and plastic surgery in the top three as well. And there are other ones. Like trauma surgery is tough, but I would put neurosurgery above that, above and beyond that. It's like 7 years too. Okay, a couple more questions. Gabriella Mamagonian. Sorry, Gabrielle. I'm trying to. What made you choose the dental route? Well, there's a big consolidation in many industries in the United States. I'm seeing it because I run Top Wineries on Instagram. I'm seeing a consolidation in wineries. We saw it start 20, 25 years ago, beginning in the medical side of healthcare. We started seeing it 5 to 10 years ago, heavily in dental, and that's going on. However, in dentistry, I was able to see that there are still mom and pop shops, and there were a lot more pre-COVID. And now there are a lot less. And with the consolidation going on, you have these big corporations buying up all the practices, right? And now I find that to be kind of disappointing, because the way I look at the American dream, everyone, my ancestors came to this country, people's families never come to this country. The opportunity, it's all about opportunity. The American dream, it's all about access to opportunity. And I think everyone should have equal opportunity. And it's what they make of that opportunity. That's what determines everything, right? And one of